healthcare has predominantly stayed pretty much the same over the last 3 or 4 decades. New medications, new treatments, new devices, yes, but fundamentally the relationship between a patient and a healthcare professional has stayed the same, and pharma's relationship with those two customer groups, whether they be a patient or a HCP, has fundamentally stayed the same. But we've had a pandemic. And the pandemic has made us reevaluate how we access any of our information, whether that be healthcare or otherwise. But let's not forget, it's a pandemic. It's the biggest healthcare scare we've had in a generation. And that's made people look to digital to provide answers more and more.
COVID-19 has actually changed healthcare, and in many positive ways, actually. It's increased patient involvement. It's really created a greater need for education and adoption of digital tools, particularly. People and patients have become increasingly willing to take control of their own healthcare journey.
There aren't many silver linings to a pandemic, but if there is one in pharma, it is the fact that it has enabled them to fast-track its use of digital. They have been forced to look at digital in a slightly different way, and let me give you an example of that. They have had to look at ways in which they talk to customers in a virtual way. Their field force cannot go and talk to customers face to face, obviously. And so by utilizing digital channels, they've been enabled to have those conversations, but in a predominantly digital manner, or a digitally driven manner.
Open Health is a healthcare agency, and we bring together a deep scientific knowledge, global understanding, and broad expertise to support our clients in improving health outcomes and patient well-being. We're built from a cohesive partnership across specialist sectors and as a group that leverages the power of the collective to ensure that patients have access to the best medicines available. Our team of researchers and medical communications experts help to simplify the complex data generated from clinical trials and make it clearer and more engaging to payers. It could be to healthcare professionals as well as patients. Our involvement supports the medical needs in bringing new drugs to market, as well as educating physicians on the use of the drug in their practice.
Evidence and Access is one branch of the Open Health organization. We largely deal with evidence generation in order to gain market access. It is beneficial in the Open Health organization to have a branch that deals with evidence generation as well as communications, because this sets us apart in our marketplace. There are a lot of medical communications firms and a lot of evidence generation firms, but we have access to both sides, which we feel sets us apart and provides us an opportunity to provide our clients with a broader range of services to help their needs.
One of the main clients within Open Health Group are the pharmaceutical industry clients. And the pharmaceutical industry is a very heavily regulated industry. So it's very important for us that we partner with our clients and with healthcare providers to generate compliant communications. And what that means is that the communications are developed in a manner that's compliant with all relevant regulatory guidance. So what we bring to our clients is a comprehensive knowledge of the relevant guidelines that apply to their specific project. And then we work with healthcare providers to help them understand the compliance landscape and ensure that everything is done in a compliant and ethical manner. I think effective communication is increasingly important in the healthcare space for a number of reasons. The first, frankly, is that there's a need to fight off misinformation. Accurate, factual information taken from primary sources is really important in driving healthcare decision-making. And so we need to work with our clients to ensure that that primary source material is technically correct, factually complete, and disseminated in a way that is approachable and digestible for the target audience.
So Open Health is fundamentally different in its approach to Omnichannel for two reasons. The first reason is that we are data-driven. Everything we do from insight through to course correction of any of our programs, whether they be brand promotion or medical communications, market access, publications, whatever, it is data-driven. The second part is that we're very much content focused, and you'll often see Omnichannel is much more about cart before horse. In other words, building this wonderful ecosystem, predominantly digital ecosystem, and then putting the content into it. Our approach is very much the other way around. Look at what the content should be, and then how Omnichannel will enable you to touch those customers in the right places. So you've got the right message in the right channel to the right customer at the right time. But it starts with data informing that creative and that content.
My name is Seema Haider, and I've been a client of Open Health for many years. We've worked together on many projects and initiatives and studies related to HEOR, medical affairs, market access, and on commercialization and strategic aspects across almost all phases of drug development over the years. What led me to Open Health was that I was looking for a partner who could think with me, not just execute, but also think along with me. So somebody who could look at strategy and understand the strategy before developing and executing a plan. I was also looking for a partner who could operate on a global level and have a good understanding of the end goal from multiple perspectives. I think it's critical to work with an agency that puts patients at the center. And the reason is that at the end of the day, we're all working towards improving the health of our patients. And we're doing this in multiple ways. One way is we're trying to help develop better drugs. We're trying to generate better, more relevant and real-world data that's representative of the patients in our communities. We are bringing this information to our healthcare professionals so that they can treat their patients in a more comprehensive and effective way. And it's all for that end goal to give access to our patients and improve their health.
Where I see the future as being is kind of a reset back to an equilibrium, where it's not entirely digital and it's not entirely face-to-face. And really the digital tools and the omni-channel communication that we're doing now is supportive of face-to-face, but really providing much more data, much more ability to communicate in various ways.
With these demands on healthcare and more focus on the needs of the people, Open Health really sees a future of continuous advancement in technology, leading in particular to a heightened patient empowerment.